Would you like free audiobooks? Click the link in the description. Question 1. A nurse is caring for a patient who has just undergone a total hip replacement. Which action should the nurse take to prevent dislocation of the new hip joint? A. Encourage the patient to sleep on the operated side. B. Place a pillow between the patient's legs when turning. C. Allow the patient to sit in a low chair to promote comfort. D. Instruct the patient to cross their legs while sitting. Correct answer. B. Place a pillow between the patient's legs when turning. Rationale. Placing a pillow between the legs of a patient who has undergone a total hip replacement prevents the legs from crossing and maintains the hips in a neutral position, which helps in preventing dislocation of the new hip joint. Sleeping on the operated side, sitting in a low chair, and crossing legs while sitting are actions that could increase the risk of hip dislocation. Question 2. A nurse is planning care for a patient with a fracture. Which type of diet should the nurse encourage to promote bone healing? A. High protein. B. Low calorie. C. High carbohydrate. D. Low fat. Correct answer. A. High protein. Rationale. A high-protein diet is essential for bone healing because proteins are the building blocks for tissue repair and growth. Protein helps in the formation of collagen, which is necessary for bone healing. Question 3. A nurse is assessing a patient with suspected compartment syndrome. Which symptom is the nurse most likely to find? A. Bradycardia. B. Hypertension. C. Pallor and coolness below the injury site. D. Increased range of motion. Correct answer. C. Pallor and coolness below the injury site. Rationale. Compartment syndrome is characterized by reduced blood flow and oxygen delivery to muscles and nerves due to increased pressure within one of the body's compartments. Pallor and coolness below the injury site indicate decreased perfusion, a hallmark sign of compartment syndrome. Question 4. When educating a patient on the use of crutches, which instruction should a nurse include to prevent axillary nerve damage? A. Keep your elbows flexed at a 30-degree angle. B. Support your weight with your hands, not your armpits. C. Ensure the top of the crutches are 3 inches below your armpits. D. All of the above. Correct answer. D. All of the above. Rationale. All the listed measures are important to prevent axillary nerve damage when using crutches. Supporting body weight with hands rather than armpits, keeping elbows flexed, and ensuring correct crutch height to avoid pressure on the axillary nerves are all best practices. Question 5. A nurse is preparing to administer ibuprofen to a patient with acute gout. What is the nurse's best action? A. Proceed to administer the medication as ordered. B. Contact the healthcare provider to clarify the order. C. Recommend increasing the dosage for better effectiveness. D. Suggest a dietary change instead of medication. Correct answer. B. Contact the healthcare provider to clarify the order. Rationale. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that can exacerbate gout symptoms in some patients. It's important to clarify the order with the healthcare provider to ensure that the medication prescribed is appropriate for a patient with gout. Question 6. For a patient with osteoporosis, which nursing intervention is most appropriate? A. Encourage high-impact exercises. B. Promote a diet rich in calcium and vitamin D. C. Advise limiting fluid intake to reduce bone demineralization. D. Recommend bed rest to prevent fractures. Correct answer. B. Promote a diet rich in calcium and vitamin D. Rationale. A diet rich in calcium and vitamin D is crucial for bone health, especially for patients with osteoporosis, as it helps in maintaining bone density and reducing the risk of fractures. High-impact exercises and bed rest are not recommended, and adequate hydration is important for overall health. Question 7. A nurse is caring for a patient with a suspected sprain. What is the initial nursing intervention? A. Apply heat to the affected area. B. Elevate the limb above heart level. C. Encourage active range of motion exercises. D. Administer a muscle relaxant. Correct answer. B. Elevate the limb above heart level. Rationale. Elevating the limb above heart level helps reduce swelling and pain in the case of a sprain by facilitating venous return and decreasing fluid accumulation in the injured area. Question 8. During a health teaching session, a nurse explains to a patient with rheumatoid arthritis, RA, the importance of performing regular exercises. Which type of exercise should the nurse recommend? A. High-intensity interval training. B. Weightlifting. C. Gentle stretching exercises. D. Long-distance running. Correct answer. C. Gentle stretching exercises. Rationale. Gentle stretching exercises are recommended for patients with rheumatoid arthritis to maintain joint flexibility and range of motion without causing additional stress on the joints, which could exacerbate symptoms. Question 9. A nurse is providing postoperative care to a patient who has had a spinal fusion. What is a priority nursing intervention? A. Encourage the patient to resume normal activities as soon as possible. B. Monitor the patient for signs of deep vein thrombosis, DVT. C. Instruct the patient to perform twisting motions to test spinal mobility. D. Advise the patient to avoid pain medication to assess healing. Correct answer. B. Monitor the patient for signs of deep vein thrombosis, DVT. Rationale. After spinal fusion surgery, patients are at increased risk for deep vein thrombosis due to decreased mobility. Monitoring for signs of DVT, such as swelling, pain, and redness in the legs, is a priority to prevent complications. Question 10. A nurse is assessing a patient with chronic back pain. Which question is most important for the nurse to ask to evaluate the impact of the condition on the patient's life? A. Do you take any medications for pain? B. How does your back pain affect your daily activities? C. What do you believe is the cause of your back pain? D. Have you had any imaging tests done for your back? Correct answer. B. How does your back pain affect your daily activities? Rationale. Understanding how back pain affects the patient's daily activities provides insight into the severity of the pain and its impact on the patient's quality of life, guiding the nurse in planning appropriate interventions and support. Question 11. A nurse is teaching a group of nursing students about the management of patients with osteoarthritis. Which statement by a student indicates an understanding of non-pharmacological interventions? A. Patients should avoid exercise to prevent joint damage. B. Heat application can help decrease joint stiffness. C. A high-impact aerobic exercise program is most beneficial. D. Patients are advised to lose weight rapidly to reduce joint stress. Correct answer. B. Heat application can help decrease joint stiffness. Rationale. Heat application is a non-pharmacological intervention that can help decrease stiffness in joints affected by osteoarthritis. It improves blood flow and flexibility, aiding in pain management. Avoiding exercise, engaging in high-impact aerobic activities, and rapid weight loss are not recommended strategies. Question 12. In teaching a patient about the proper use of a cane for left-sided weakness, what should the nurse instruct? A. Hold the cane in your left hand and move it simultaneously with your left leg. B. Hold the cane in your right hand and move it simultaneously with your left leg. C. Keep the cane on the left side, but slightly behind your body. D. Use the cane only when walking long distances. Correct answer. B. Hold the cane in your right hand and move it simultaneously with your left leg. Rationale. Holding the cane in the hand opposite the weak side, right hand for left-sided weakness, and moving it simultaneously with the affected leg helps distribute weight away from the weak side, improving balance and stability. Question 13. A nurse is providing discharge instructions to a patient who had knee surgery. Which statement by the patient indicates a need for further teaching? A. I will use ice packs to reduce swelling. B. I should keep my leg elevated when sitting. C. I'll make sure to rest my knee all day to prevent pain. D. I will perform the prescribed knee exercises daily. Correct answer. C. I'll make sure to rest my knee all day to prevent pain. Rationale. While rest is important after knee surgery, complete rest all day is not recommended as it can lead to stiffness and slow the recovery process. Encouraging gentle, prescribed exercises and periods of elevation and ice application are important for healing. Question 14. A nurse is planning care for a patient with a lower extremity cast. What is the priority nursing intervention? A. Encourage the patient to wiggle the toes frequently. B. Keep the cast covered with a blanket at all times. C. Apply heat to the casted area to promote blood flow. D. Suggest that the patient remain in a seated position to reduce swelling. Correct answer. A. Encourage the patient to wiggle the toes frequently. Rationale. Encouraging the patient to wiggle the toes frequently helps maintain circulation in the affected limb, reduces the risk of swelling, and can help detect any sensory or circulatory issues early. Question 15. A patient with a history of lower back pain is advised to maintain a healthy weight. What is the rationale behind this advice? A. Excess weight can increase the risk of osteoporosis. B. Extra weight puts additional stress on the back muscles and spinal column. C. Being underweight can lead to bone density loss. D. Weight loss will automatically improve posture. Correct answer. B. Extra weight puts additional stress on the back muscles and spinal column. Rationale. Excess body weight increases the load on the back muscles and spinal column, exacerbating lower back pain and potentially leading to further musculoskeletal issues. Maintaining a healthy weight helps reduce this stress and can alleviate symptoms. Question 16. A nurse is educating a patient on the prevention of osteoporosis. Which dietary recommendation is most appropriate? A. Increase intake of fatty fish and sunshine for natural vitamin D. B. Limit calcium intake to prevent kidney stone formation. C. Focus on a high-protein diet, avoiding dairy products. D. Eliminate gluten to improve calcium absorption. Correct answer. A. Increase intake of fatty fish and sunshine for natural vitamin D. Rationale. Fatty fish and exposure to sunshine are excellent sources of vitamin D, which, along with calcium, is essential for bone health and the prevention of osteoporosis. Limiting calcium, avoiding dairy, a primary source of calcium, and eliminating gluten without a medical need can be counterproductive for bone health. Question 17. For a patient who has undergone anterior cruciate ligament (ACL) reconstruction, which instruction should the nurse emphasize during rehabilitation? A. Limit knee flexion to less than 60 degrees at all times. B. Avoid weight-bearing exercises for the first 6 weeks. C. Perform high-impact sports to strengthen the knee. D. Engage in physiotherapy and controlled knee exercises. Correct answer. D. Engage in physiotherapy and controlled knee exercises. Rationale. Engaging in physiotherapy and controlled knee exercises after ACL reconstruction is crucial for recovery. These exercises help strengthen the knee and improve flexibility without overstraining the newly repaired ligament. Question 18. A nurse is assessing a patient for signs of scoliosis. Which observation would the nurse expect to find? A. An even waistline. B. Symmetrical shoulder height. C. Uneven shoulder blades. D. Equal leg lengths. Correct answer. C. Uneven shoulder blades. Rationale. Uneven shoulder blades are a common sign of scoliosis, a condition characterized by an abnormal lateral curvature of the spine. This can lead to visible asymmetries in the body, such as uneven shoulder blades or hips. Question 19. A nurse is caring for a patient with a cast. The patient reports intense pain beneath the cast that is not relieved by pain medication. What is the nurse's best action? A. Advise the patient to rest more frequently. B. Elevate the casted limb above heart level. C. Prepare to bivalve the cast to relieve pressure. D. Apply a heat pad to the area for comfort. Correct answer. C. Prepare to bivalve the cast to relieve pressure. Rationale. Intense pain beneath a cast that is not relieved by medication may indicate compartment syndrome or pressure sores, which require immediate intervention. Bivalving the cast can relieve pressure and prevent further complications. Question 20. When teaching a patient about managing chronic tendinitis, what should the nurse emphasize? A. Regular application of cold packs to reduce inflammation. B. The importance of complete immobilization of the affected tendon. C. Starting intensive exercise immediately to strengthen the tendon. D. Taking prescribed NSAIDs only when pain is unbearable. Correct answer. A. Regular application of cold packs to reduce inflammation. Rationale. Regular application of cold packs can help reduce inflammation and pain associated with chronic tendinitis. While NSAIDs can be used to manage pain, they should be taken as prescribed, not just when pain is unbearable. Immobilization and intensive exercise need to be balanced carefully to avoid further injury. Question 21. A nurse is caring for a patient post-laminectomy. What is a critical postoperative instruction? A. Engage in twisting motions to check spinal flexibility. B. Avoid bending, lifting, or twisting for a specified period. C. Start lifting light weights to strengthen the back muscles. D. Perform sit-ups daily to enhance core strength. Correct answer. B. Avoid bending, lifting, or twisting for a specified period. Rationale. After a laminectomy, it's crucial to avoid activities that strain the back, such as bending, lifting, or twisting, to allow proper healing and prevent complications. Core strengthening exercises should be reintroduced gradually and under medical supervision. Question 22. For a patient with fibromyalgia, which lifestyle modification should a nurse suggest to help manage symptoms? A. Engage in high-intensity workouts daily. B. Maintain a regular, moderate exercise program. C. Increase caffeine intake to improve energy levels. D. Restrict sleep to 6 hours to prevent fatigue. Correct answer. B. Maintain a regular, moderate exercise program. Rationale. For patients with fibromyalgia, maintaining a regular, moderate exercise program can help manage symptoms by improving sleep, reducing pain and fatigue, and enhancing overall well-being. High-intensity workouts, increased caffeine intake, and sleep restriction can exacerbate symptoms. Question 23. A nurse is developing a care plan for a patient with a recent below-knee amputation. Which goal is most appropriate? A. The patient will demonstrate mobility with a prosthesis within 1 day post-op. B. The patient will express acceptance of limb loss within 2 days post-op. C. The patient will manage phantom limb pain effectively using multimodal strategies. D. The patient will avoid all pain medication to quicken the adjustment period. Correct answer. C. The patient will manage phantom limb pain effectively using multimodal strategies. Rationale. Managing phantom limb pain effectively using a combination of strategies, e.g., medication, physical therapy, mirror therapy, is a realistic and important goal for a patient after amputation. Immediate mobility with a prosthesis and rapid emotional acceptance are unrealistic expectations. Avoiding pain medication is not advisable for managing postoperative pain. Question 24. A nurse is instructing a patient on preventing low back pain. Which ergonomic advice should the nurse provide? A. Sit in a soft, deep couch to ensure comfort while working. B. Use a firm mattress and sleep on your stomach. C. Maintain a neutral pelvis and use a chair with lumbar support when sitting. D. Lift heavy objects by bending at the waist and using back muscles. Correct answer. C. Maintain a neutral pelvis and use a chair with lumbar support when sitting. Rationale. Maintaining a neutral pelvic position and using a chair with lumbar support help in keeping the spine in a natural alignment, reducing the risk of low back pain. Sleeping on a firm mattress is advisable, but not on the stomach, as it can strain the back. Lifting should be done by bending the knees and using leg muscles, not the back. Question 25. A patient is diagnosed with a herniated disc. What symptom is most likely associated with this condition? A. Decreased reflexes in the affected limb. B. Increased bladder control. C. Absence of pain in the lumbar region. D. Improvement in symptoms when lying flat. Correct answer. A. Decreased reflexes in the affected limb. Rationale. A herniated disc can compress spinal nerves, leading to symptoms such as pain in the lumbar region, numbness, and decreased reflexes in the affected limb. Increased bladder control and absence of pain are not typical symptoms. Symptoms may worsen when lying flat due to increased pressure on the disc. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.